All right, everybody, welcome back for another deep dive. Today, we're getting into the world of central venous catheters,
CVC.
CVCs,
Yeah.
and I am very excited about this one.
I'm sensing some trepidation in your voice.
Well, because I think that, people hear central venous catheter and they think medical jargon. They think boring. Like, why would I possibly want to learn about this? This is something that, my doctor might tell me I need or whatever, but why would I want to, spend an hour on this?
No.
But this deep dive is jam-packed with fascinating history.
Yeah.
Really unexpected kind of twists and turns. And
it's a surprisingly fascinating history.
it is, yeah.
Yeah.
So obviously these catheters are placed in large veins near the heart, and they're used for all sorts of medical treatments.
Yeah. That's right. And that's kind of the key, is that they're in these big central veins, and so you can give a lot of stuff through them, whether it's medications, or you can even do things like dialysis, which is basically, taking all the blood out of the body, cleaning it, and putting it back in.
Right. And so we're going to get into all of that today. But first, let's start with the history,
Okay.
because this is wild.
Yeah.
So we're starting in the early 1900s with a German surgeon named Dr. Bleichroeder.
Yeah. Bleichroeder was doing some fascinating work with catheters, in dogs and humans.
Right.
But the thing about Bleichroeder is that he kind of thought what he was doing wasn't that big of a deal.
Really?
Yeah.
So what was he trying to accomplish? He was just like, let's just stick these in there and see what happens.
I mean, he was doing it very systematically and trying to learn about, the circulatory system.
Okay.
But it wasn't until later on when chemotherapy for cancer came on the scene that he kind of had this realization, like, wait a minute, I've got a way to deliver these powerful drugs directly to where they need to go.
Right.
And that's kind of when the light bulb went off.
Yeah.
And he really saw the potential of this technique.
Wow. So he was way ahead of his time in a way, but also kind of didn't realize what he had?
Yeah, he was just tinkering
Yeah.
and came across something huge.
Tinkering. I like that.
Yeah.
Okay, well, that's one for the history books. But let's talk about another character here.
Okay.
This one is Dr. Werner Forsman.
Forsman. I love this story.
Oh, this is good.
So Forsman's a surgical resident in Germany in the late 1920s.
Okay.
And he is convinced there has to be a better way to access the heart directly from medical treatments.
Okay.
Right.
Mm-hmm.
Because up until this point, we're talking about some pretty rudimentary techniques.
Right.
And he's got this idea for a catheter-based approach.
Okay.
But here's the thing.
Yeah.
He can't convince anybody to let him try it on a patient.
Right.
So what does he do?
What does he do?
He decides to experiment on himself.
He didn't.
He did. He inserts a catheter into his own vein.
No way.
Yes.
Oh, my God.
Guides it all the way to his heart.
What?
And if that wasn't enough,
How did he know what he was doing?
well, he had studied the anatomy very carefully, and he had this idea.
Right.
And he was a little bit as a daredevil, you might say.
I'd say.
So he does this procedure on himself.
Wow.
And then to prove that he actually did it, he walks himself and the catheter upstairs to the X-ray department.
He just walks upstairs.
Oh, yeah.
Oh, my goodness.
Casually strolling through the hospital,
That's amazing.
gets an X-ray to document the whole thing.
Wow.
Talk about dedication to your craft.
That's incredible.
Wow.
So what was the reaction like when he shows up in the X-ray department?
Well, you can imagine the folks in the X-ray department are probably like, what in the world is going on here?
Yeah.
But, he shows them the X-ray. He's like, see, I told you.
I did it.
And this is where it gets interesting, right? Because you think a discovery like this,
Right.
self-experimentation,
Nobel Prize.
Nobel Prize, you would think instant acclaim, right?
Yeah, you would think so.
Not so fast.
Oh,
The medical community at the time is not impressed.
really?
Yeah, they think he's reckless.
Oh, really?
I think it's too dangerous.
Yeah.
And they're not quite sold on this whole catheterization idea.
Interesting.
It takes years.
Mm.
And the work of researchers like Andre Cournand and Dickinson Richards to really refine Forsman's technique and prove its value.
So they picked up the ball and ran with it, basically.
They did, and they focused on using catheters not so much for treatment at first, but for diagnosis.
Okay.
So they were using it to study heart function, to measure pressures inside the heart.
Mm-hmm.
And that really helped to make the method more widely accepted because it provided this valuable information that you just couldn't get any other way.
Right.
So they were really instrumental in kind of legitimizing this technique that Forsman had pioneered.
Interesting. So even though he kind of, went rogue, he still was on the right track.
He was definitely onto something.
Yeah.
And in a way, his audacity kind of forced the medical community to pay attention.
Right.
Even if they didn't like how he went about it.
Right.
But eventually, good science wins out.
It does.
And in 1956, Cornan and Richards were awarded the Nobel Prize in Physiology or Medicine for their work on cardiac catheterization,
Wow.
which really solidified the importance of CVCs in medical history.
Yeah, that's a great point because it's like, okay, maybe one guy kind of went about it the wrong way, but look what ultimately came of it.
Exactly.
So it's like you can't discount it entirely.
And it just goes to show that, the path of medical progress is rarely a straight line.
Right.
It's often messy.
Yeah.
There are setbacks.
Yeah.
There are controversies.
Yeah.
But ultimately, those breakthroughs that have the biggest impact,
Right.
they find a way to shine through.
That's really cool. Okay, so we've got accidental pioneers and Nobel Prize drama.
Yeah.
Where do we go from here?
Well, we can't talk about CVCs without mentioning parenteral nutrition.
What is that?
Parenteral nutrition is basically a way to deliver nutrients directly into the bloodstream.
Okay.
So instead of eating food, you're getting all of your nutrition through an IV.
Okay.
And this is where things take an interesting turn, because it's World War II that really highlights the need for this life-saving technique.
Of course. That makes sense.
Yeah, because you've got all these wounded soldiers, some with injuries so severe they can't eat normally.
Right.
And doctors are desperate for a way to provide them with the nutrition they need to heal.
Sure.
Enter CVCs.
Okay.
They're the perfect solution for delivering those life-saving calories and nutrients intravenously.
Interesting. Wow.
So it's this kind of unexpected consequence of war
Yeah.
that it really drives this innovation in medical technology.
Right. So we've talked about the history of CVCs, but let's actually dive into like the catheters themselves.
Okay.
What goes into the design of these things?
Yeah, so it turns out that designing a CVC, it's actually a lot more complicated than you might think. You have to consider the materials you're using, the size and the shape of the catheter, and then all sorts of factors related to the patient's anatomy and the specific medical condition that you're trying to treat.
So it's not just a matter of like, here's a tube, stick it in.
No, not at all.
There's a lot of thought that goes into these.
Right. And one of the biggest challenges is that, veins, while they're blood vessels, they're actually quite delicate.
Really?
Yeah, they have these layers to them.
Uh-huh.
And the structure of those layers allows them to be flexible,
Okay.
but it also makes them prone to damage.
Interesting.
So if you're not careful when you insert a catheter, or the catheter itself is too stiff or irritating,
Yeah.
it can actually damage the vein,
Oh, wow.
which can lead to all sorts of complications.
Like what kind of complications are we talking about?
Well, one of the biggest risks is infection.
Okay, that makes sense because you're basically creating a direct pathway into the bloodstream. So if any bacteria happen to hitch a ride on that catheter,
Right.
they have a free pass into the body.
Exactly. And that can lead to a really serious infection.
Wow.
Another risk is something called thrombosis.
Thrombosis? What is that?
Thrombosis is basically just a fancy word for blood clots.
Oh, okay.
And when you have a catheter sitting in a vein, it can disrupt the normal flow of blood,
Okay.
which can increase the risk of clots forming.
Interesting. So how do they design catheters to try to prevent these clots from forming?
Right, so that's where the choice of materials comes in.
Okay.
Early catheters were often made of these really stiff materials like polyethylene or PVC.
Uh-huh.
And those materials, while they were durable,
Yeah.
they were also more likely to irritate the lining of the vein.
Okay.
And that irritation could trigger the formation of blood clots.
That makes sense.
So there was this big push to develop catheters from softer, more biocompatible materials.
Like what?
So nowadays you see a lot of catheters made from things like silicone or polyurethane. And these materials are much gentler on the veins.
Yeah.
They're less likely to cause that irritation that can lead to clotting.
Interesting.
And they've actually also found that even the surface texture of the catheter can make a difference.
Really?
Yeah, so some catheters are now designed with these really smooth surfaces.
Okay.
And that's because they found that a rougher surface
Yeah.
can actually create tiny little areas where blood clots can start to form.
Oh, wow. That's fascinating.
So it's really amazing how much detail goes into these designs.
Yeah. It's like every little thing matters.
It really does.
When you're talking about something that's going into the body like that.
Right, because, even the smallest amount of friction or irritation
Yeah.
can potentially have big consequences.
Right. So they're trying to minimize all of those potential problems
Exactly.
through these tiny little design tweaks.
Exactly. And it's a constant process of innovation.
Right.
They're always looking for new materials,
Yeah.
new coatings, new ways to improve these catheters.
Wow. It's really incredible
It is.
how much thought goes into these things.
Yeah, and it's all in the name of patient safety.
Right.
They want to make these devices as safe and effective as possible
Of course.
because they really do save lives,
Right.
but they also have the potential to cause harm if they're not used properly.
So it's a delicate balance
It is.
between those benefits and those risks.
Exactly.
Wow. So we've gone from those early pioneers like sticking tubes in their own veins to these really sophisticated devices that we have today.
I know. It's kind of mind-blowing when you think about how far we've come.
It is. And it really makes you appreciate how much work goes into like every little aspect of these catheters.
Absolutely. And, it's easy to kind of forget about them because they're often hidden away inside the body,
Right.
but they really are these unsung heroes of modern medicine.
They are. They're literally keeping people alive.
Exactly. And, one of the things that I think is so fascinating about CVCs is that it's not just one device.
Yay.
It's this whole family of devices.
Right.
We've got different types of catheters for different purposes,
Mm-hmm.
different sizes, different materials.
Different lengths.
Yeah, it's all very carefully tailored to the specific needs of the patient.
So you've really got to choose the right tool for the job.
Exactly. And that's where the expertise of the medical team comes in.
Right.
They're the ones who are assessing the patient's condition,
Yeah.
figuring out what type of catheter is going to be the best fit,
Right.
and then making sure that it's inserted correctly and cared for properly.
So it's a whole process.
It is.
It's not just as simple as, like I said before, just sticking a tube in there.
No, it's definitely more nuanced than that.
Yeah. So as we wrap up our deep dive into the world of CVCs, is there anything else that you think our listener should keep in mind, or any like final thoughts you want to leave us with?
I think the big takeaway here is that CVCs are a great example of how medical technology is constantly evolving.
Okay.
And we're always looking for ways to improve these devices,
Right.
to make them safer, more effective, and more comfortable for patients.
Right. And we've come a long way,
We have.
but there's still a lot of work to be done.
Absolutely. And, one of the most exciting areas of research right now is in the development of new materials
Okay.
that are even more resistant to infection.
Oh, wow. That's huge.
Yeah. Because as we talked about before, infection is one of the biggest risks with CVCs.
Right.
So if we can find ways to reduce that risk,
Yeah.
that would be a major breakthrough.
Absolutely. So what are some of the other things that researchers are working on in the world of CVCs?
Well, another area of focus is on improving the insertion process,
Okay.
making it less invasive and more precise.
Uh-huh.
Because even though we've gotten pretty good at inserting these catheters,
Yeah.
there's always that risk of complications.
Right.
So that they're developing new techniques, new
Yeah.
imaging technologies
Okay.
that can help to minimize those risks.
Very cool.
And then, of course, there's the ongoing work on patient education.
Right, because none of this matters if the patient doesn't know how to properly care for their catheter.
Exactly. Because, even with the best technology in the world,
Yeah.
if the patient isn't on board,
Right.
if they're not following instructions,
Right.
then things can still go wrong.
Absolutely. So it's a team effort
It is.
between the medical professionals
Right.
and the patient to
Exactly.
make sure that these devices are used safely and effectively.
Couldn't have said it better myself.
Well, on that note, I think that wraps up our deep dive on central venous catheters.
Yeah, thanks for having me. It's been fun.
Always a pleasure. And for everyone listening, we'll see you next time when we delve into yet another topic that you probably didn't know you were so interested in.
Until then, stay curious.
Bye, everyone.